I thank the gentleman very much. Director, just one final point that comes out of the testimony of Dr. Homer Venters, who is an adjunct faculty at the NYU College of Global Health, who was with us in our previous hearing. His investigation revealed a disturbing lack of access to care when a new medical problem is encountered. We've heard those questions, line of questioning coming from several members. This process called sick call in most carceral settings relies on the ability of incarcerated people to submit a written or electronic concern and then be seen in a face-to-face encounter with a day or two. In the first BOP facility that he had the time to had the opportunity to visit, as he inspected the Metropolitan Detention Center in Brooklyn, New York, it quickly became apparent that not only were many people reporting that their sick call requests, including COVID-19 symptoms, were being ignored, but that the facility was actually destroying their original request, which violates basic correctional standards. As this is an accountability hearing and it is a recognition that there should be, if you will, accountability and the exercise of punitive measures, we all have concluded that these are human beings deserving of restoration and dignity, men and women. Can you comment on that kind of action?
Yes, Congresswoman, I appreciate you allowing me to clarify that. First off, I am aware of the report. We looked into it. We followed up. I won't discuss that specific incident, but I will reassure you that each of our institutions has an outpatient hair clinic. It's overseen by a board state certified physician and a medical director. We have outside oversight. We have Joint Commission, AAAHC, ACA. We've received the same reviews that any outside clinic or nursing home would have. Our mortalities are reviewed by independent reviews. So I'm not sure. I mean, we get oversight. If there's a mistake made or something of that nature, we're going to look into it and do something about it, correct the issue.
Thank you, Director. What I would ask specifically is some of the questions that may not have been answered more thoroughly. Our staff will get with you so that we can get answers in writing, and that in particular at the Metropolitan Detention Center in Brooklyn, New York. Your memory, or it may not have come to your attention, I'd want a direct response and answer on that matter. And I thank you for that. I'm also going to suggest that there is a Board of Health oversight for the Department of Prison, Federal Bureau of Prisons. I know that you do have a number of other agencies, but I think one that is specifically focused on helping the Bureau going forward will be very helpful. Let me finally submit into the record, man is 16th to die from COVID-19 at Fort Worth Prison. Cases spike at women's facility. So as I conclude, Director, let me say I'm not sure of whether or not you'll appear before this committee or committee in the other body, but let me take this opportunity to show our appreciation from a person who has chosen as his career to serve the nation. And obviously coming into the Bureau many, many years ago, you have continued to make a commitment to serve this nation. So it is my privilege to be able to say thank you for your service. It should not go unnoticed. You've served under many administrations, Democratic and Republican, and you've chosen to commit yourself to hopefully the lives and the ultimate liberty of individuals that we hope will be restored and will enter into society and never to return again. I hope that is your vision. You've stayed, and as I thank you, I want to make sure that we thank the hardworking officers who go by the appropriate mixture of reform, accountability, and compassion. So thank you again for your testimony this morning. This concludes, and your service to the nation. This concludes today's hearing. Thank you to our distinguished witness for attending. Without objection, all members will have 5 legislative days to submit additional written questions for the witness or additional materials for the record. The hearing is now adjourned. I hope that